Hello guys, I am back with another video on case study. Today I am going to discuss shock. My name is Abrar Pathan, so let us begin. Kindly ignore the voice of the kittens. A 33-year-old pilot is transferred to the emergency department after she was involved in a cargo plane crash during a military training exercise in South Korea. She is conscious but confused. She has no history of serious illness and takes no medication. Primary examination shows numerous lacerations and ecchymosis over the face, trunk, and upper extremities. The lower extremities are cool to touch. There is no continued bleeding despite the application of firm pressure to the sites of injury. The first physiological response to develop in this patient was most likely which is the following. So guys, please try to pause and answer this question. Okay. So let me help you guys with this question by providing some hint. So this patient's history of trauma, numerous lacerations and ecchymosis, cool extremities and continued bleeding despite the application of pressure are the concerning for hemorrhagic shock. Okay. So guys, what happens in the hemorrhagic shock? Tell me, or if you know, please write it in the comments. Okay, so let us understand shock. So shock, it's a life-threatening disorder of the circulatory system that results in inadequate organ perfusion and tissue hypoxia, causing metabolic disturbances and ultimately irreversible organ damage. Okay, so let us understand this shock with the help of one type of a shock, that is a hemorrhagic shock. Okay, so when the patient is bleeding profusely, okay, the body will say that my blood is going, okay, I need to give the blood to essential organs like liver, brain, or heart. Okay, so the blood will be shunted from the less important organ, that is the skin and viscera, to these organs, that is brain, liver, and heart. So there will be coldness in the extremity. Okay, so that is a very important sign of the shock. Okay, now as the shock progresses, okay, this blood will be less in the body. Okay, so what will happen, that this organ which our body was trying to save for life, of course, that will also die. Okay, so that will cause a irreversible organ damage. Okay, so this is fundamentals of the shock, hypovolemic shock. Okay, there are numerous types of shock. I am not going to explain this in this video. If you want, I will prepare a separate video about it. Yes, so we have got a stage of shock. So we have got three stages of shock. Okay, first is the pre-shock, second is shock, progressive phase, and third is the end organ damage or stage of decompensation. Okay, so this is very important, guys. To answer the question, we need to understand this diagram or this table. Okay, so in the pre-shock, okay, as there is more blood loss from the body, okay, so this will cause a peripheral vasoconstriction. Okay, and this manifests with cold, clammy extremity and increased capillary refill time. Okay, and there is also decreased capillary hydrostatic pressure. Why? Because the blood, it consists of 50% of water. Okay, so as blood is lost, the water is also lost, right? So This will cause a decrease in capillary hydrostatic pressure. Hydrostatic pressure is basically pressure due to water in the blood. Okay, so as the blood is lost from the body, this capillary hydrostatic pressure will also decrease. Okay, so yeah, and peripheral so this is important. In the distributed shock, it is a type of shock where peripheral vasoconstriction may be absent. Okay, now tachycardia, why? Because so when the blood in the body is less, okay, this will signal the carotid sinus present on the wall of the aorta, or the bifurcation of common carotid artery. It will carry signals to the medulla oblongata. Okay, from there the medulla oblongata will give signals to the heart to increase the contraction of the heart. Okay, so that will cause a tachycardia. Okay, and and oliguria. Why? Because GFR will be decreased. Okay, now step 2, that is a progressive phase. So in this shock will have worsening hypotension. Okay, hypoperfusion of peripheral tissues, general tissue hypoxia, and as a result the tissue which was performing the aerobic respiration, it will switch to the anaerobic respiration. Okay, so and this will cause a lactic acidosis, which in turn causes worsening tachypnea. Why? Because lactic acid is very toxic for our body. Okay, and acidosis and cerebral hypoperfusion and altered mental status. Okay, and now coming to the third. Now the third step of the third stage of shock, we have got end organ dysfunction, that is the stage of decompensation. Okay, in this case the cerebral hypoxia, which is very dangerous for our body, it will happen. Myocardial ischemia will happen, that is the decreased blood flow to the heart. Okay, white blood cell necrosis causes release of lysosomal enzymes in blood, which will cause a further tissue injury, worsening of shock. Okay, and activation of immune system, release of cytokines, and DIC. This is very fucking dangerous, guys. This is very dangerous. DIC is very dangerous. It is very difficult to treat. Okay, DIC is very dangerous. Disseminated intravascular coagulation. Okay, and finally we have got bowel ischemia, bacteria, and sepsis. Okay, so you just need to learn this table. Okay, and this is very important. Okay, so our answer will be option A, that is increase in the heart rate. Now let's quickly try to answer this question. So an increase in heart rate is the first compensatory mechanism for hypovolemic shock and may be seen as early as class 1 hemorrhagic shock. Okay, in this patient, blood loss has resulted in hypovolemia and decreased stroke volume. The heart rate increases as a result of intracardiac and arterial baroreceptor reflexes to help maintain cardiac output. Initially, this mechanism may be sufficient to compensate for the volume loss. Patients in class 1 hemorrhagic shock may be otherwise asymptomatic. As shock progresses, compensatory mechanisms become overwhelmed by volume loss, resulting in further derangements in vital signs, that is tachycardia, hypertension, tachypnea, and hypoxemia. Okay, so whenever you see these 4 signs, immediately think of a hypovolemic shock. Okay, and damage to multiple organ system. So guys, our answer is increase in heart rate. Okay. So yeah guys, thank you for watching and see you tomorrow. Bye.